So good evening. Today we are starting the MCQ of the mood disorders. We have learned one YouTube session on the depressive disorder, the mania disorders, the happy part of the life. So we take advantage of this question, this topic to learn about the happy part of the life. We now will learn about the depressive disorder and concept and the types and the understanding. We take this advantage of this theory to help the MCQs and we'll do the MCQs. So before this, a brief about us. So you can unlock the Unacademy free plan by using my code drsandeep10. We know we keep this to enjoy the learning, uninterrupted. We do a lot of free classes on the Unacademy app. I am Dr. Sandeep Govil, teaching psychiatry for last 15 years for various PG examination. The Plus subscription offers you benefit of the daily live classes, chats with the educator, engage in the discussions. You can ask your doubts, answer polls all the while the class is going on. Structured courses, live test and quizzes, and the unlimited access to the knowledge. You can watch any videos whenever you wish. You can download the PDF of the notes of the class. We at the platform Unacademy offer you the iconic subscription, which is best of the two learning platforms like Unacademy and the Prep Ladder. So get the best of the Unacademy, where we have live classes and the batch courses and live test and quizzes, and best of the Prep Ladder, where we have video lectures and the question bank and rapid revision courses. The T20 is over, but the championship is live here every day at 9 p.m. for the NEET PG 2022, and for the NEET PG 2021 we have the live test on the 8 p.m. So we have a ritual of psychiatry classes for which I use the unlock code of drsandeep10 at every Thursday, Saturday, Sunday 10:30 p.m. to 12 a.m. So we missed the Sunday this time, so we are doing it tomorrow, and we are keeping our neurobiology of psychiatric illnesses. Also, I am also, this Thursday we are leaving because it's a New Year celebration. Everybody will do in their own ways and their home, but we don't want to disturb and keep it. So we keep it on Saturday, Sunday maybe. And YouTube session, which is scheduled on every Tuesday 11 p.m. So schedule was at 10:30 p.m. usually, but because of some time allocation we have to go to 11 p.m. Simple way to download the Unacademy Learning app is go to the Google Play Store, download the Unacademy Learning app, search for NEET PG, look for the iconic subscription, select the Plus or the iconic subscription, and 12 months is for the 55,000. Apply the code drsandeep10, you get a discount of 10%, and this is my code to join Unacademy, unlock the free plan on the Unacademy, and so on. So now let's understand the depression. So what in English we called as depression, in psychiatry it is being called as the major depressive disorder. Nothing major about it, only a way to understand. So we know for depression there has to be a persistent, pervasive mood depression for more than 14 days. We have a sadness of mood. We have a lack of interest. And we have the lethargy. Sadness of mood, lack of interest, and lethargy. Three main cardinal symptoms. Then we have the poor attention and concentration, forgetfulness, decreased appetite, we may have weight loss, we have decreased sleep. Classically, we have a early morning awakening. We have decreased libido, and we have the I feel like crying all time. I feel excessively guilty about things. एंड थोड़ा थ्योरी हो गया डॉक्टर साहब, सॉरी MCQ अभी करेंगे so that you enjoy the MCQ. Then we know, you know, it's ideas of hopelessness, helplessness, worthlessness. We have pessimistic view of future. And we have death wishes. God, please take me away. I should kill myself. And suicidal attempt. We know we have the mild depression. We have the moderate depression. Mild is 2 plus 3 for 14 days. Moderate is 2 plus 4 for 14 days. I hope you understand 2 plus 3 and 4. You remember that. Any two of this, any three of this for 14 days has been called as the major depressive disorder, mild. Any two of this, four of this will be called as the major depressive disorder, moderate. And anything more than 2 plus 4 for 14 days will be called as the severe depression. We know severe depression is of two types. Severe depression without psychotic symptom, severe depression with psychotic symptom. Psychotic symptom क्या क्या है डॉक्टर साहब? I am hearing voices, hearing voices. Voices are telling me to join above. I am the negative syndrome, the Cotard syndrome. I have a delusion of guilt, delusion of sin. बहुत पाप करा मैंने, पापी हूँ मैं, and so on. Why should you differentiate? Because treatment of somebody with the psychotic symptom is electric shock, and somebody attempting suicide is also electric shock. So this is the basic nomenclature of the depression. Mood disorder में सब लोग चले गए. Okay. So that's a very basic concept. Now we have this question. Features of depression include all except. So we have learned we have depressed mood, we have loss of appetite, we have suicidal ideas, but there is no would you like to answer? Hyperactivity. Very good, Dr. Mishra. So hyperactivity is not there. ठीक है डॉक्टर साहब, very good. So that's why we have learned. Okay. Then we had a simple MCQ. I'm writing it for you. Significant weight loss in depression is more than 10% in 1 month, more than 10% in 3 months, more than 10% in 6 months. बताइए डॉक्टर साहब. It's a very very tricky MCQ. Simple lollipop asked in the examination, and we know answer is A, B, C, D. What? The moment we see this question, our mind goes to the PSM book. PSM book, HIV TB topic. Significant weight loss is 10% तो पक्का है. 1 month, 3 months, 6 months, we keep on thinking that. And the moment we get the click in the mind, we mark the answer. But we forget that they are not asking you about the HIV TB. They are asking about the depression. For depression, the significant weight loss is more than, बताइए डॉक्टर साहब, anybody? 5% in 1 month. Tricky but simple. It's a for depression, any weight gain, weight loss is a 5% in 1 month. नहीं डॉक्टर साहब. Yes, it is this. For the HIV TB, we know for HIV TB or medical condition, they say it's a this much. Okay. Now, then we come to the somatic symptoms of depression are all except. We know somatic मतलब bodily symptom of depression include all except. Bodily symptoms of depression include all except feelings of guilt, reduced libido, insomnia, or what? Weight change. We know answer is the, बताइए डॉक्टर साहब. ABC, डॉक्टर अंकिता. Very good. Very good. It's a cognitive symptom. It's a mindful symptom. It's a cognitive symptom. सही है डॉक्टर साहब, बिल्कुल सही जवाब दिया आपने. Answer is A. So somatic symptoms are all except the feelings of guilt. Feelings of guilt is a cognitive symptoms of depression. Feeling of guilt, sin, that's a cognitive symptom. Which of the following are the features of depression? We say that anhedonia is there, decreased appetite is there. Anhedonia is lack of experience of pleasure, वो है. Decreased appetite, altered perception. So we have all except the altered perception. Usually नहीं होता है ना, until it's a very severe depression where we have the auditory hallucination. But otherwise usually we have a anhedonia, decreased appetite, normal focus and so ये भी नहीं होता है, sorry. We don't have this also. And ये भी नहीं होता है, sorry. So then the answer will be more this. So we have anhedonia, decreased appetite, altered perception, but we don't have the normal focus and concentration. Now, retract मत करिए डॉक्टर साहब, गलती से हम सीखेंगे. This is a new term in the DSM-5 and ICD-11. Not a feature of DMDD. What is DMDD? It's a disruptive mood dysregulation disorder. Not a feature of DMDD. Temper tantrums, irritability, socio-occupational problem at work and home, excellent response to the mood stabilizer. Answer is, anybody want to do? दो ही लोग हैं वैसे तो. Not a feature is the D. It's an excellent response to the SSRI. That is why it has been clubbed up with the depressive disorder. It has been a boon to somebody, some children who have been classified as a mood disorder because of the irritability. They have been classified as a mania NOS, mania not otherwise specified, but now we know it is a separate entity where the child is disproportionately anger between 6 to 12 years of age. So anger is disproportionate to the age and the reason. So temper tantrums, irritability and so on. So the excellent response is to SSRI, not to the mood stabilizer. There is also a term called as the dysthymia. Dysthymia in 1992 has been come from the word thymus, meaning the mood. It's a subsyndromal depressive symptom for 2 years. Never it becomes syndromal. So in the 1995 in medicine, it has been called as the type D personality. In 1940, it has been called as the depressive personality disorder. And in 1940. And in 1960, it has been called as the neurotic depression. ठीक है डॉक्टर साहब. But currently it is being called as the persistent depressive disorder. So now the name has been changed. It has been called as the, as per DSM-5, ICD-11, it has been called as the persistent depressive disorder. For 2 years in adults and for 1 year in children less than 12 years of age. Good evening, Dr. Aditya. So we have been just learning a bit of a theory to comfortably doing the MCQs. ठीक है डॉक्टर साहब. Now here comes the atypical depression. All are the, बताइए जितने लोग हैं MCQ कर लेते हैं डॉक्टर साहब. Leaden paralysis, reactivity of the mood, TCAs are preferred over the SSRI, increased appetite and the weight gain. In the atypical depression, all are the features except. बताइए डॉक्टर साहब. क्या नहीं है। फिर हमको थ्योरी पढ़ाना पड़ता है, आप कहते थ्योरी की पढ़ाते हो। You do MCQ for us, we'll be happy and move ahead to the next MCQs. In psychiatry, there is something in psychiatry called as the atypical depression. Answer for this is the C. We know atypical depression we have a increased sleep and lethargy. Increased sleep and lethargy. There is a increased appetite and weight gain. There is a reactivity of the mood. Leaden paralysis. Body is heavy like a lead. And there is a rejection sensitivity. They are so much sensitive to rejection. Somebody, not picked up my call. I become so sensitive. It's a rejection sensitivity. We say that the drug of choice of this is the MAO inhibitor, monoamine oxidase inhibitor, and otherwise we don't give them for the cheese reaction or hypertensive crisis which could precipitate. So we prefer the SSRI over TCA. So we prefer the SSRI over TCA. That's a atypical depression. ठीक है डॉक्टर साहब. Now we know chronic subsyndromal depressive symptoms for a period of more than 2 years is being called as the dysthymia, now being called as the persistent depressive disorder. Now being called as the persistent depressive disorder. ठीक है डॉक्टर साहब. Okay. So this is dysthymia. There is something in psychiatry called as the cyclothymia. You must have read. So as the name suggests, there is a cycling of the mood. So the subsyndromal depressive symptoms fluctuates with hypomanic symptoms, usually within a day, without any apparent cause, for 2 years. So we all have been blessed by friends like them. We soon remember them. We all have friends who are quite warm, quite cheering, quite charming in the morning. In the evening you meet them, they give you a strange look. You're totally surprised what happened to the gentleman, why they are behaving like that. So that's a cyclothymia. Ask your friend to regulate his mood, because otherwise 33% will go for a mania. Ask your friend to control his mood. Risk is high that 1/3 will go for a mania. ठीक है डॉक्टर साहब. Now we had a double depression with. Double depression is, we know, friend of mine who has not given a party, who was having the depressive personality disorder, Now sometime really become depressed. Sometime really become depressed. That will be called as लोग आ रहे हैं जा रहे हैं मज़ा नहीं पा रहे हैं. We have been very less MCQs, so it's but we are just talking about the concept so that no MCQ has been missed up. So depression with dysthymia. Double depression is depression with dysthymia. Somebody with the dysthymia now become depressed. That will be called as the double depression. So we know the depressive disorder today in 1992 and onwards. In 1960 it has been called as the endogenous and reactive depression. They say in reaction to a loss I am depressed. It's a endogenous depression. It's a reactive depression. I lost my exam. I lost my friend in the I lost money in the business. I am depressed because of that. It's a reactive depression. For no reason I am depressed. It's a endogenous depression. Welcome Dr. Sanjay. Please do join us at the special classes platform also and enjoy the learning. We can actively participate there longer time and we take up the all MCQs. So pranam hai aapko bhi for joining with us in such a late night session of YouTube. So the tricky MCQ of the double depression is that double depression is it's a endogenous. Tricky MCQ ये था depression on neurotic depression. We know neurotic depression is another name for the dysthymia in 1960. We have learned that. So double depression is a endogenous depression on the neurotic depression. ठीक है डॉक्टर साहब? Okay. Now we see that the higher cortisol levels are seen in which of the following condition. Higher cortisol level we know in depression there is a non-suppression of cortisol release after dexamethasone suppression test. ठीक है. So higher cortisol level are seen in the depression. So there are only two tests. First is the non-suppression of the cortisol release on DST, and there is a increase REM frequency and duration in patients of depression. So that is the two findings. Okay. Then we have a simple MCQ. I don't think we have MCQs now. Yes. So we know that the most common cause of suicide is depression. The most common phase of depression for suicide is depression in recovery, also been called as the paradoxical suicide, asked in the NEET and the AIMS last year. Paradox here is that depression is improving but the person commits suicide. Okay. Then we know there is the most common age and gender for suicide is elderly men. Yes. Then we have there is something in psychiatry called as the psychological autopsy is done for. It is done for suicide. And chemical responsible for suicide is the serotonin. Okay. Then we say that the females will transmit the illness more compared to the males, and mania will be transmitted more compared to the depression. ठीक है डॉक्टर साहब? So if somebody asks you that the most risk of transmission of the illness to the next generation, it's a female with mania or male with mania, or female with depression or male with depression. The answer will be female with the mania has the highest chance that the illness goes to the next generation. नहीं डॉक्टर साहब, वो serotonin नहीं है, because low levels of 5-HIAA, hydroxyindole acetic acid, in CSF of persons who committed suicide. 5-HIAA is the metabolite of serotonin. It's a metabolite of the serotonin. So not the dopamine, it's a serotonin which has been there. Now let's enjoy the last from MCQs, that the concordance rates in monozygotic twins. We know for mania it is 70%. For depression it is 50%. For schizophrenia it is 46 to 48%. For OCD it is 33 to 35%. If we have learned like this, we had a simple MCQ. Somebody's identical twin sister having depression, what is the risk that she will have depression? Answer is 50%. Somebody's identical twin having a mania, what is the risk that she will have a mania? The answer is 70%. And the simplest question is, the most heritable illness in psychiatry is mania, depression, schizophrenia, OCD. The answer will be undoubtedly the, इन चारों में से मोस्ट हेरिटेबल कौन सा होगा डॉक्टर साहब? Among the four, the most heritable is the mania, undoubtedly. Okay, 70% डॉक्टर साहब. We have seen it's a 70%. But surprisingly, substance abuse. We know substance abuse, we all blame my character and my friend's character for my addiction. But it is basically my genes which is responsible for my substance abuse. And the most heritable among all psychiatric illnesses is the autism. So that is, I think, all about the basics of the depressive disorder. We have a YouTube for the manic understanding. But this we do the concept and the usual MCQs of the concept of the depression and the prevalence, the genetic loading, and what is the risk of transfer to the next generation. So I thank you so much for who joined with us and enjoyed this half an hour of more of a theory with us. So see you tomorrow at the neurobiology of psychiatric illnesses at 10:30 p.m. on the special classes with the special, unlock the code Dr. Sahab IN Sahab Sandeep 10. You can join us with Dr. Sandeep 10 for tomorrow's class. Anything else you want to ask, Dr. Sahab? ठीक है डॉक्टर साहब. So good night. Thank you so much.